Good evening, friends. I'm Dr. Aajay Shah, bringing you this another great weekend evening live. And today I have a great guest. I know our guest very recently for about last 2 months or so, but I've been very impressed. And actually, we were just talking before we started the live that we all need to create this healthcare team actually, where we all have different experts in our team, a physician, a pharmacist, a nurse, exercise physiologist, and many other members of the team. She herself is a double board certified pharmacist, a great person. She writes actually every day a quote about life. So that's another dimension I want to cover about her. And we will be bringing her on a regular basis. Her name is Bhavna Mutha. Welcome, Dr. Mutha.
Hi, Dr. Shah. I am so happy to connect with you on this platform. I'm excited to have this lovely talk for our audience. And like you said, yes, a collaborative practice agreement is my passion. A strong doctor definitely needs a very strong team of pharmacists, nurses, PAs, and of course, I will represent the pharmacist pool today in terms of diabetes as a topic, what role we can play, how much our patients love us, and what difference we can make into the society in terms of the drug information and knowledge that we have. So thank you for having me today. Thank you for your kind words and introduction. And yes, I am excited to take this to a further level. Thank you, Dr. Shah,
I
for the
think
introduction.
I want to say right in the beginning, because this will be a regular series on our page once a month, possibly more often. But let me tell you what my views are on a pharmacist. Even when I was in medical school, even when I was intern in America, I always respected pharmacists as a shoulder to shoulder health professional. I always reached out to them for learning about different medications, side effects of medications, interactions with not just with other medications, but interactions with other health conditions, for example, kidney function, liver function, everything else. Plus, knowing the pharmacies are always available to guide you in making any decision, because we know now pharmacy or pharmaceutical industry is an ever-going industry. We develop new drugs pretty much on a daily basis, and a physician humanly just cannot keep up with all the advancement into new pharmaceutical drugs coming out. Particularly if you are a primary care physician, there are so many drugs for the physician has to learn on an everyday basis. And that's where I think the role of the pharmacy comes in. So I sincerely believe that bringing Bhavna Mutha on our page as an expert pharmacist will add tremendous value to our page, teaching all our followers and viewers about what is the role of a healthcare team. So that's my perspective on a pharmacist. I fortunately had a great pharmacist in my career, and I'm very thankful to all of them. And now we have this great association with Bhavna Mutha. So today's topic is actually very timely topic: diabetes. Type 2 diabetes is becoming very prevalent, and we will talk about how common it is with Dr. Mutha. So let's talk about Bhavna, about diabetes, how common it is in America, how common it is in India, because we also have a lot of Indian viewers, and how common it is in the world.
Diabetes is a topic that is very close to my heart. And I'll tell you in terms of numbers, uh, I would say from a 2017 consensus that I came across, 30 million Americans are suffering from diabetes, which is 9% of your population. And out of this 30 million Americans, this is from 2017, about 90% of the population is suffering from something called type 2 diabetes. So in terms of numbers, that's the consensus. If we put India or the rest of the world, I'm sure the numbers will be alarming. Many a times, in Indian food habits or lifestyles, um, we are more prone to have something like type 2 diabetes because of the amount of carbs that we consume in our food. It directly affects your internal body structure, bringing on diabetes into your life. So those are some of the numbers. Now come to 2020, today's scenario is completely different. We all are battling Corona, COVID. We are all buckled into our households. Our daily routines and lifestyles are completely affected. And that has caused a mental health toll in a large amount of population. How does mental health and diabetes go hand in hand? I'll tell you what. Mental health can cause anxiety, it can cause depression. Depression sometimes leads to something called binge eating, meaning, you are mindlessly just gobbling on the food because of the emotions that you're facing. So those were the numbers I told you from 2017. And if we come with the consensus for 2020 and diabetes and type 2 diabetes, I'm pretty sure the numbers will surpass. But those are something that roughly we can look at in terms of the diabetes consensus.
Yeah, I think I agree with you. I think actually it's interesting. I did just a informal, obviously very small sample size in my own practice. So I took my own patients. So these patients are referred to cardiology practice. So they're already a biased population. And I did about age 65. And I followed them for 48, like for 2 days in my practice. And the prevalence of diabetes above age 65 in my practice, which is a cardiology practice, was almost 20 to 25%. So I think, as I understand from the national numbers in the Medicare population, particularly in African Americans, diabetes is as high as 20%. That's very, very alarming. And as the obesity gets further and further worse, diabetes, type 2 diabetes will start coming in higher and higher. So I think that's a very pressing issue. So we are talking about a very, very, right topic today. So please tell us, what are the types of diabetes and how can a person know what type of diabetes that he or she has?
So I'm going to go in lay terms. Most of the people by now know that there are two types of diabetes, type 1 and type 2 diabetes. Type 2 diabetes, as I told earlier, is more prevalent compared to type 1. In type 1, your body does not have any capability to produce endogenous insulin, basically completely no insulin production, and that puts you into the type 1 zone. Now talk about type 2. Type 2 is something like silent killer. It could be inside your body, lingering in there for ages, and sometimes just an accidental discovery through the labs can tell, oh my God, you have type 2 diabetes. In type 2 diabetes, the pancreas, the beta cells, islets of Langerhans, they are responsible for producing insulin. They will do the job, but they are just not up to the mark. And sometimes the body is confused in terms of utilization of the insulin. So those kind of people will fall in the category of type 2 diabetes. Now, to ingrain the type 1 and type 2 into your minds, I'll portray two examples. And I like to come out with examples all the time because stories stay with you longer than the numbers I would speak today, right? So as I grew up in my childhood, there was an aunt who was very close to me. She adored me as a child. Over a period of time, all of a sudden, I hear from my parents talking, saying that she's almost losing her vision. And suddenly she goes blind. So as a child, I'm helping her, go from point A to point B because she's completely lost her sight. And I see a person with complete vision going completely blind in my life. She passed away, but her about 12 years of her life she spent being blind. And this was coming from her being type 2 diabetes. Later on, as a pharmacist, when I studied diabetes, she ran through my mind every single time that if she had known what she had, if she was treated in the right time, her going blind would not have been a case. So that is an example of type 2 diabetes. In terms of type 1 diabetes, I have a cousin who's 24-year-old. I know, healthy, happy-go-lucky child. And one morning we just hear that she's hospitalized into diabetic coma, and this is for real. And we as a family are completely shocked, for her to have come out with type 1 diagnosis for the diabetes. And later on, we see that her body's immune system was attacking and she was classified as type 1 diabetes. So the type 1 diabetes can come from genetic factors, it can come from a viral insult, or it can come from an immunological attack into the body system. So this is how you can remember the type 1, where this child was in young age in coma, and the type 2, where my aunt over a period lost her eyesight completely. So those are the two types of diabetes, and they're classified on the basis of insulin production into the body system.
That's a very good explanation. I think, as I understand, when I was in medical school, type 2 diabetes was actually considered an adult onset diabetes. But now, that concept or that kind of definition has been changed now, because we are seeing more and more type 2 diabetes in kids, and as young as 10, 15-year-old kids, because of the obesity. So I think it's no longer called adult onset diabetes. Now it's just called type 1 and type 2. And there's another type, I think it's called type 1.5. It's not that much described that way, but that's where you have an adult who loses the pancreatic function and does not produce insulin because of immunologic issues, and they are called type 1.5. So I think type 1 and type 2 are the most common. So let's talk about type 2, because as I understand, type 2 is 90% of all diabetics. So type 2 is most common type of diabetes, type 2. So what are some of the risk factors for developing type 2 diabetes?
Absolutely. And that's so, the risk factors for people who can have a higher chance of type 2 diabetes is your age, about 45 years of age. If you are a woman who has delivered a baby over 9 pounds, macrosomia is what we would call. If you are of a certain race, pretty much every race falls into this factor, Indian American, Asian American, Native American, Latinos, African American, all the races are, predisposed to having type 2 diabetes. And the bigger factor is the food that we consume, more white and processed food and more canned foods that we consume. We don't even realize what we are putting into our body systems. In terms of lifestyle, sedentary lifestyle, people who are obese, who are inactive, who do not like to exercise, they are having very, very high risk of falling into the type 2 diabetes zone. Low HDL levels. HDL levels are always better as you exercise. And so low HDL levels, high triglycerides, risk of ASCVD, any atherosclerotic cardiovascular diseases, underlying conditions, they all make you prone, because our body system is all interconnected with each other. So these are some of the basic factors that make you prone, out of which the highlighting, big factor would be obesity, number one.
I agree with you. I think obesity is number one risk factors, and certain ethnic background, certain racial background, and I think lack of exercise, poor sleep, even I think predispose you to prediabetes and diabetes. So let's talk about how we can prevent type 2 diabetes first, and then we will cover what are some of the medications for type 2 diabetes, because a lot of our viewers and followers are fortunately are not type 2 diabetic yet, and they all have interest in preventing type 2 diabetes. And obviously, when you know your risk factors and you try to correct the risk factors, but I want your opinion, your views on anybody who does not have diabetes, type 2 diabetes, possibly has pre-diabetes, or even does not have pre-diabetes, what he or she can do so they never develop type 2 diabetes.
So absolutely, and I did an interview the other day. My biggest mantra is prevention is better than cure. Prevention is something that's in our hands, and it can come with discipline, very easily come with discipline. So to understand, I always like to make funny examples when I'm talking to my audience, so it sticks with them. So say, for example, you are working for a company and your boss brings on, 2 files, 4 files on your desk, and then 5 files, 10 files, and now the pile goes up to 50 files on your desk. As an employee, you are sitting with those 10 files and you're like, okay, I'm going to go what you're asking for. But when the files are up to 50, you are going to drop it and you're going to say, enough. I cannot take it no more. I'm going to call it quits. Now you're going to wonder, where is she going with this example, right? So think about the same thing in our body system. Okay, so you put in your ice cream, half a pint of ice cream, 2 cookies, and toast breads, white breads that you like, and a nice big plate of pizza and lasagna. And this is all going to this person, the employee, which is your pancreas, who has to work, right? What is your pancreas saying? It's upset because you're throwing a lot of files on that pancreas. And at some point, the pancreas is going to be like, I don't like this, and it's not able to keep up with the demand that we are asking for it to function, and slowly it will diminish, or will not be doing a good job or actively involved in supporting your body system. So coming back again, keep it in your mind how much workload. Growing up, Dr. Shah, my dad always used to talk about fasting. And when I said, Dad, fasting is very, very hard, he would say, your body system is working hard every single day. And so if you're fasting one day, all of your organs are happy because they don't have to work hard that day. And so you're giving them a holiday. And I just love that concept, because when we are not thinking about what we are putting into our body system, we are making our organs work harder than what they should be. So talking about prevention of diabetes, to me, it will come with discipline, discipline of your food habits. We all crave, and sugar is the new addiction now. We talk about drug addiction, we talk about opioid crisis and opioid addiction, but sugar is another addiction. I myself have a sweet tooth, and you just need to know how to control those urges or do a portion control. Even if you were to eat something, a piece of cake or whatsoever that you want to indulge in, go fat free, go carb free if possible. So again, learn to read the nutrition labels when you buy a product. How many grams of sugar or carbs is going into your body system. Be more educated, be more aware of what food choices you're making. Go organic, go high diet of vegetables. Know your fruits that have high glycemic index. Sometimes we make a mistake thinking we are eating fruits, and so you want to forgive yourself for what you're eating. But there are fruits like watermelons, bananas sometimes can have a high glycemic index. They're still better compared to processed food, but make right choices on eating more berries or citrus fruits. So those are a couple of things. And if you think of me and prevention of diabetes, think about that employee who had to deal with those 50 files, and just stop yourself in discipline, thinking I need to stop somewhere and make right choices. So that
Wow.
would an ulterior way of preventing diabetes.
No, I think I agree. I think that's an excellent analogy. Matter of fact, our good friend Mr. Monahan also said that was a great analogy. And that's a very easy way to explain, how pancreas gets overworked and overconsumed, and eventually causes it to quit. And that's when I think person starts not just having type 2 diabetes, but also need the insulin for type 2 diabetes. And as a cardiologist, as an internist, I understand that. I think if a person loses even 10% of their body weight, type 2 diabetes almost can go away. So that means if a person is 200 pound and has type 2 diabetes, just by losing mere 20 pounds, they can be off a lot of their diabetic medications. And same way, if a person who is 200 pounds and does not have diabetes, if loses 20 pounds, he or she has a very, very high chance of avoiding type 2 diabetes in the future. Also, regular exercise, just 20-30 minutes of brisk walking. Like I said earlier, adequate sleep, because sleep also predisposes a person to pre-diabetes, diabetes. Whenever I've not slept because being on call, next day my appetite is like 5 times more. I reach out for very unhealthy food. Same with stress management, having high cortisol level. Cortisol spikes your sugar. So having some kind of a technique to manage the stress, so that way your pancreas doesn't get overburdened with all these spikes in the sugar. Like you said, not reaching out to all those processed food, white rice, white pasta, white bread, having a lot of sugary treats like cakes and cookies and sweets and all the chocolates. I mean, all those things may not insult you if you have it once a month, but if you do it 3 or 4 times a day, eventually, with your own example, like you said, pancreas is going to call it quit. So I think type 2 diabetes, in my opinion, is close to be 100% preventable disease. And if a person works with simple techniques, that person can prevent the type 2 diabetes. And fortunately, actually, even if a person has type 2 diabetes, if they follow certain things, they can actually reverse the type 2 diabetes completely. I have given a 4-hour seminar on diabetes. It's already on YouTube. It's one of the most comprehensive seminars on diabetes. It covers everything anyone needs to know about diabetes. I highly recommend to watch that seminar. So let's talk about how to diagnose diabetes? Like what are the numbers in terms of sugar and some of the other parameters like A1C we follow to diagnose the diabetes?
Absolutely. So to diagnose the diabetes, the test that normally doctors will use, and a lot of people already know, is HbA1c, FPG, fasting blood glucose, and PPG, your random glucose or your postprandial glucose. Now, A1c itself is something so interesting. I'll tell you, when 20 years ago, I was reading my subject as diabetes, I always read that 7% is what they looked in terms of the A1C. In 2 decades, look at the evolution or change. It's a paradigm shift in the change of the numbers, where now the doctors are aggressively targeting the A1C numbers, where you look for 5.7 or 6 or 6.4, from 7 to 5.7 or 6.4. What has changed in this 20 years? Our lifestyle. Like you say, stress, high cortisols causes and havoc onto your body systems. You just want to run your work, you're tired from your work, you will grab some food that is not healthy for you. And such a large shift in the numbers have equally caused concerns to make a tighter control on the A1C numbers. A1C is a test that diagnoses diabetes more accurately because it's a test over a period of 3 months. So it doesn't depend on what you had last night. Your fasting blood glucose sometimes can be not very accurate. Say you didn't have a great, or you had the big meal last night where you had consumed a lot of carbs and sugar and everything like that. If you check your fasting blood sugar next day, definitely those numbers are not going to be an accurate representation. So I like to be dependent on A1C. Every family member or every close friend of mine that I have educated about diabetes, I put the A1C numbers in their head. It is not that difficult to know what your numbers are. Get that test done every 3-6 months or annually, depending on your health conditions. And then, of course, if you're type 1 and even bad type 2, then you will look for the fasting blood glucose. Your doctor will tell you how many times you need to test throughout the days. So the other test nowadays they commonly also do is the C-peptide. I'm pretty sure you might be aware of that. And sometimes it will help you diagnose insulin resistance testing to diagnose the polycystic ovarian syndromes. So those are a couple of factors. In terms of symptoms, you will experience fatigue, tiredness, polydipsia, polyuria. That will tell you somewhere that something is not right with my body. Let me go check with the doctor. And then those are the tests that we can look for to see if you are heading close towards prediabetes or type 2 diabetes or type 1 diabetes for that matter. So those are a couple. Yeah.
I think that's an excellent explanation. I think to repeat what you said, any A1C above 6.5 is considered diabetes. A1C between 5.7 and 6.5 is pre-diabetes, and below 5.7 is not pre-diabetes or diabetes. At the same time, I must say that 5.7 is just an arbitrary number. That number was given based on the lowest risk of complications, but ideal or optimal number is actually anywhere around 5 to 5.2. So if somebody wants to make all the lifestyle changes, in my opinion, do not stop even at 5.7. Our American Diabetic Association recommends A1C of 7 when the people are on drugs or insulin, partly to prevent the low sugar levels and hypoglycemia. But if a person is reversing the diabetes with the lifestyle changes, that 7 is not necessarily the number to stop. As long as the person is off the insulin and off all the medications, where the hypoglycemia or low sugar reactions are extremely rare, almost never heard of it with lifestyle changes. Lifestyle changes should continue until not just even 5.7, but in my opinion, 5.2. To give you my own personal example, my A1C had gone up to 5.9 about 4 years ago, 3.5, 4 years ago. Since then, I lost about 50, 55 pounds. I exercise every day. I sleep well, 7, 8 hours. My A1C now is 5.1. My A1C is actually better than our son, who is 31 years old. So I think it's completely reversible just in a few months to few years. So I tell all diabetic patients, please, please do not stop at 7 if you're doing it lifestyle. Keep going down and down and down and go down until about 5.5, 5.4. Because as I also understand, the ideal sugar, ideal fasting sugar actually has to be 84 or below. Even the 100 is the number for pre-diabetes, but 100 is still too high. And I remember from the early years before 2003, the fasting sugar of 140 was the diagnosis of diabetes. And that number came down to 126 in 2003. And my sincere guess is that in 5 to 10 years, American Diabetic Association will actually tell us that it's not 126, maybe it's 118 for the diagnosis of diabetes. Because like I said, any sugar above 84 is not healthy. So that brings the next important topic. And that's everybody wants to hear it today. And that's about what medications we should be using typically for type 2 diabetes. Today we will cover type 2 diabetes. So number one medication which has been prescribed all over the world, even in America, is metformin. And metformin has a lot of, we call pleiotropic benefits. That means a lot of other benefits than just lowering the sugar. So I want your views as an expert pharmacist on metformin, on diabetes, and also on longevity.
Absolutely. And yes, metformin, if I had to mention metformin, I was reading a journal the other day published in NIH, which said metformin is a 21st century aspirin. And I was like, wow, look at this. Everybody talks about aspirin, and now metformin is a 21st century aspirin. Metformin is everywhere. In terms of, promotion of usage of the drug, many of the companies here in the South, metformin is available completely free of cost, no copay, no charge, even if you didn't have insurance. So metformin has gained a large popularity over a period of time. And I was reading this article, I just couldn't contain myself, and I went reading back to the history of metformin. So 1500 BC is when, Egyptian parahos were accidentally discovered this herb, which was used to treat hyperglycemia. And the drug, the plant is Galega officinalis. So there was an accidental discovery. They were using this medication that was extracted from the plant, and it was in the form of gonadin. Gonadin was still not very streamlined or not very synthesized. And so there was a large proportion of cardiac mortality, and there was a large proportion of lactic acidosis from the medication. Even then, European countries were using metformin from 1920 onward for the treatment of hyperglycemia. It was introduced into United States of America, but because the drug was not very streamlined or synthesized correctly, and from the side effects, it didn't exist in the market until 1995 is when United States and the Joint Commission of European Academic Commission, they had a meeting where I think somehow United States approved approval of metformin in US, and the drug really hit the markets in US in 1995. From 1995 to 2020, metformin is a common household name that is even called or compared to aspirin. So yes, you're right. It is now the first line agent for the treatment of diabetes. Metformin's brand name was, come out from I think it's a scientist who named it as glucophage. I forget the scientist's name. I'm blanking at this moment, but glucophage, phage is eater. So it is glucose eater, and that's how the name came into the market as glucophage. So that's the history of metformin. In terms of the dosage of it, 500 milligrams, 1000 milligrams, you can go up to 2000 or 2500 milligrams of the dosing. Extended releases can be taken at bedtime. Again, 2000 milligram would be the dosing. what are the side effects from metformin? And this is so interesting. I love this part because many of the people taking metformin will complain about stomach upset and diarrhea. And the biggest one, which is a healthy side effect, is weight loss. And which is why this drug becomes sought after in treating type 2 diabetes, as well as targeting the weight loss that any diabetic patient will try to achieve. Those are the side effects in terms of metformin. What do you want to look out for when you're taking metformin? Drugs like cimetidine. Cimetidine is something that they use for treating acidity. Metformin and cimetidine are not good friends. Alcohol and metformin, they do not go well together. It's going to aggravate your lactic acidosis. So those are the two things that you want to look out for. And the third thing, if you have any procedure that has to do with contrast dye, you want to be making sure your doctors will always tell you, to stop metformin 48 hours before. But that is another no-no combination. If you're on metformin, you have to stop the drug before such procedures. So that is everything about metformin. Now, in terms of which kind of population cannot benefit from metformin, it is pretty safe medication that's why it's the first line agent. So people who do not have healthy kidneys, or their EGFR, which is the glomerulus filtration rate, which tells your kidney function, is in between 30 to 45, your doctors will, outweigh the risk versus benefit. If it is above 45, you're still in the safer zone to take the drugs like metformin. So those are some of the numbers that you may not remember it all as a patient, but in your mind, those are the things that you need to know: the max dosage, the possible side effects. What to look for is the kidney function, and the drug interactions. I didn't put a lot of them out on here for you to remember. 3 or 4 things that you need to know when you're taking your metformin. So that was everything about the history of metformin. I loved reading the history, by the way, how it came from guanidine to bigonides. Bigonides are now more synthesized, more streamlined, and that's why they are more safer compared to when the drug was discovered in 1925. So that is everything about metformin, Dr. Shah. And I have taken the medication regularly for about 8 years. If that gives confidence to my audience, yes, it has made a humongous difference. The very first month I started the medication, it suddenly took the sluggishness off, and it felt like, greasing the body, where your body's ready to be back into action. That's my personal feeling. I was wanting to refrain from telling that, but sometimes, sharing your stories will motivate your patients, and I like to keep it that way when you build the rapport.
I think you have a good company too. I'm on metformin too myself. So I think as I understand, metformin obviously is great for type 2 diabetes. I mean, it prevents the gluconeogenesis in the liver, and it has a lot of benefits in terms of preventing the glucose production in the liver. But at the same time, as I understand, metformin actually also upregulates this AMPK pathway, which actually pathway is shown to increase the longevity. So now actually there were some trials were going on that some of the results are not out yet, but metformin is considered like a fountain of youth. I mean, it's going to be one day considered a drug for longevity. And when I listened to David Sinclair, who is the Harvard scientist, who actually gave us this resveratrol protocols and resveratrol science. He is a PhD from Australia. He actually himself takes metformin. He's not even pre-diabetic. And he sincerely believes that metformin actually is the drug for longevity. So metformin definitely, just like when we talk about statins, metformin has a many pleiotropic, lot more benefits than just benefits on the sugar. So metformin definitely a good drug to talk to your doctor about it. The next drug, which I want to cover, which again, just to tell people, I'm also on that drug, and that drug is called acarbose. And again, acarbose is also another drug which has a lot of pleiotropic effects, and acarbose actually is also being studied as a drug for longevity also. So what are your views on acarbose?
So yes, and coming back to metformin, I totally forgot the longevity aspect of it. The trial you just mentioned is called TAME trial, TAME. It's targeted anti-aging metformin usage, something on those lines. So yes, you're right. Metformin is a drug for longevity, and you mentioned AMPK, which I missed out, the hepatic usage. And you're going to be surprised, Dr. Shah, metformin has a new recognition in the world of preeclampsia. I was amazed when I saw that. And it has capability of working on the anti-angiogenic factors inside the body, something on those lines. I just read this about a few days ago, and they are looking into it because patients suffering from preeclampsia can be a huge burden in terms of dollars spent into being hospitalized. When I was pregnant, there was another woman who was suffering from preeclampsia and was in hospital for days and long period of time. So there is clinical trials out there on that as well, if somebody wanted to look further. So now let me digress from that and come back to acarbose. So metformin has capability of bringing your A1C in the range of, I would say, 1.2 to 2.5%. Acarbose comes after that. It's a little bit lesser compared to metformin in reducing the A1C. I would say somewhere from up to 1.1%, if I remember the numbers. It is more commonly used for PPG, postprandial glucose control. So sometimes you may not achieve a complete accurate control and on your blood sugar levels, and you suddenly see a spike in your blood sugars after meals. In those cases, acarbose, the brand name of the drug is Precose, could play a very, very big role. The acarbose comes as a 25 milligrams, 50 milligrams, 100 milligrams. It's almost done 3 times a day. And the dosing is weight-based. So if you're above 60 kgs, you could go up to 100 milligrams 3 times a day. With acarbose, what happens, we recommend taking it with the first bite of the meal. So what it does, it is coming from your body system straight to the colon. And so that's why, it's not breaking those carbohydrates to increase your postprandial sugar, but that will constitute some fermentation into your body system, leading to the side effects that we talk, like, maybe diarrhea, flatulence, something on those lines. So that's everything about acarbose. Now, when you're taking that medication, what are the other no-no drugs? And to make you remember that, I just go in an easy lay language, the narrow therapeutic drug like digoxin and your warfarin. I call them bad guys. I call them bad guys because even a small, deviation with these drugs into your body system can cause, bad numbers or havoc into your body system. So you want to be very careful with digoxin use. And if you're also doing warfarin, you want to monitor your INR levels when you're taking the precarbose. So that is pretty much everything about this drug. I have not seen it as commonly prescribed like metformin, but they too can aid together to target your A1C numbers. Like you said, if you're 5.4, you're even beating me. So that's such a great number. And that's everything I could mention about acarbose today.
Yeah, I think I also read about acarbose that people who are on acarbose, because those carbohydrate, particularly the soluble fibers and carbohydrate which are undigested and reaches the colon, the bacteria in the colon actually have a great time having those undigested carb and fiber. And I was even looking at some studies that people who are on acarbose, their microbiome is even better, and microbiome diversity is even maintained. So I think acarbose definitely has a lot more effects than just lowering the sugar. That brings some of the newer medications for diabetes. Diabetes is a very evolving science. I mean, in last 5 years, so many more drugs have come out. Some of the drugs are great in terms of even benefits on heart failure, benefits on cardiovascular complications. So please tell us a little bit about some of the newer drugs. Obviously, we will cover all diabetic drugs in a separate talk, but please tell us some of the newer drugs which you think are like a breakthrough in diabetic care.
Yes, absolutely. So with diabetes, after your acarbose categories, there are sulfonylureas, there's glimepiride, glipizide, those category of drugs. Then comes DPP-4, which is dipeptidyl peptidose for drugs that are also commonly prescribed. Then comes your SGLT2s, which is sodium glucose transporter, 2 inhibitors. And the last one that is becoming very popular is the GLP, it's glucagon peptide drugs, which are in the forms of injections. Now, as a pharmacist or as a doctor, you agree, like these drugs are evolving so rapidly, they're marketed, and it's so hard to keep up with all of this medication sometimes. So these GLPs are always in the form of injections. With diabetes, you always see that obesity is associated with it. So many of these drugs are sometimes now used in pre-diabetes or type 2 diabetes, not pre-diabetes, type 2 diabetes, to target the weight loss. If I remember it, Byetta and Biduron is one of those medication, the generic name of which is exenatide, which comes from a hormone that's secreted inside this animal, and it constitutes towards weight loss. So that is prescribed very commonly, if you see, because it is going to not only just aid on A1C control. After metformin's kingdom over A1C control, these GLPs are playing a very big role in A1C controls and are popularly prescribed. So in terms of my patients today who are listening, if I were to say some of the names, the brand names like Ozempic, Tanzium, Victoza, Byetta, Biduron, and liraglutide, semaglutide, these are the generic names of these medications. Pretty much they are working in the same mechanism of action. The difference in these drugs is the dosing. It could be 0.5, 0.75, how you inject once a week or how you inject daily. The refrigeration standards are different for all of these medications. Some will be good up to 14 days, 28 days, and 56 days. In this whole category, there's only one drug that is coming in solid tablet form. And I think it's a form of Saxenda. It's called Ribelsus. It's a very brand new drug that comes as a tablet form that works under this mechanism. So these are some of the very commonly and popularly prescribed, until I was last practicing in retail, I see a lot of prescriptions on Victoza, a lot of prescriptions on Trulicity, Tanzium, all of those medications. Ozempic was a new one. And when I conversed with my patients many times, sometimes they would just say, my doctor is helping me get to my weight loss, goals. This is helping me feel better and energetic and motivated to exercise and stuff like that. So that's one category of drug that's becoming very popular. Now, when you're talking about these drugs, two things you want to keep in mind. They will interact with the absorption when you're taking pain medications and when you're on antibiotics. So you want to, separate the injections by at least 2 hours. Bad things about those drugs that you want to remember, it could very possibly cause pancreatitis in long term. And there's a black box warning for these drugs. And that black box warning talks about possible causes of thyroid carcinomas. It's just good to know, it's something that somebody needs to be scared of, because we always have to look at the risk versus benefit. If you are taking the medication, if your A1C is controlled, if your numbers are good and you're motivated to exercise, the side effect may not kill you as faster compared to the usage of the drug that's going to save you. That's how I always talk to my patients when they have reluctance on taking the medication. You really need to sit down, conduct a motivational interview with them, make them open up and understand the blockage. Because even my family members will just come up and say, we don't like taking medications. That's it, and, chapter closed. So you have to sit back and tell them that the side effect that it's going to cause is going to be a longer period of time or damage as compared to the protection it's going to do, because it's saving your body from microvascular complications, which I wanted to talk about earlier, is retinopathy, nephropathy, and neuropathy. These are the 3 aspects that stay in control just by keeping your A1C controlled, just by keeping your numbers correct. You are going to be protecting yourself from the blindness story that I told you earlier, or going into a diabetic coma if you're type 1. So we need to set that mentality correct in terms of taking medications.
Wow, yeah, no, I mean, you cover so much well about all the medications, and I think that brings actually segue into importance of controlling the blood pressure and cholesterol. Like we all know that all diabetics they don't die from high sugar. I mean, rare one would, but most diabetics die from heart attacks and strokes. So I think that's where controlling blood pressure and cholesterol becomes as important as controlling sugar. So please tell us your views on those two.
Yes, absolutely. And that's my favorite question right there. So when I talk about teamwork, when we talk about teamwork in our regular world where a couple of people are assigned towards a project, if we don't work like a team, success is not coming to us, right? So in terms of our body, the same factors will apply. If your lungs, your heart, your eyes, your brain, they did not talk to each other collaboratively, that system is going to shut down. It's going to cause an havoc. So let's analyze, lipid, your blood pressure, and your diabetes. If your diabetes numbers are high, if your A1C number is high and you're careless about it, where is it targeting towards? Towards your kidneys. Now the kidneys are not happy. So if your kidneys are not happy, they're supposed to control your blood pressure, right? They play a big role through the RAS system and all of that. So your blood pressure is out of control. Now the blood pressure is out of control, not pumping and not doing the correct job. Who is it targeting? It's targeting your heart. The heart is overloaded with the work that's coming its way, and the heart is going to be unhappy. And you hear that somebody had a cardiac attack, and the whole system falls down just like that. So one thing, if they are all interlinked with each other, triglyceride and diabetes completely go hand in hand. You see the numbers rising with triglycerides, you see the sugars going high. You see the sugars going high, you see the triglycerides going high. They are like directly proportional to each other. Blood pressure, diabetes, and kidneys, they're all intermingled with each other. So having proper control on all of these numbers will reduce your risk of ASCVD humongously. Before you just have a sudden heart attack and you see what just happened with my body, all these basic underlying factors play a big role. Controlling your cholesterol, controlling your blood pressure, controlling your diabetes. These are the three things. As pharmacists, we do something called medication therapy management, and I love this aspect. I'm not even utilizing entire knowledge, in this set of working. I'm just sitting down and telling my patients on the most important aspect of being adherent to the medication. The doctor prescribes the medication, the blood pressure was high, somebody took it for a month. I don't think I need this anymore. I feel fine. And the patient will drop the medications many times, not do the refills. It could be the cost, it could be the laziness to go pick up the prescription, it could be any factor that they just have in their mind. I don't have any disease and I don't need to take this medication anymore. My blood pressures must be okay. So that in medication therapy management, we sit down and we nail those factors on importance of taking this medication, because ABC, your heart, your blood pressure, your diabetes, are the basic controllers of your entire body system. Then comes mental health, all other aspects of it. But you need to have a control on these things. So this is the interlink that I like. When you mentioned about it, LDL and plaque and ASCVD and diabetes, this is how interconnected they are. So my message to the audience is, please take your medications correctly. Please keep an eye on your numbers, on your reports that you see from the doctors. And when you go see a doctor, make the most out of the visit. Make notes, because you tend to forget what questions you want to ask. And that little time the doctor is trying to know you, get your symptoms, diagnosis, you will tend to forget the most important question you want to ask. After doctors, you can always come to the pharmacist. And anybody in United States who has insurances, who are 65 and up, I want to give you a message. There's something called MTM Pharmacist. You are eligible for free reviews with your pharmacist twice in a year. You have an entire hour to sit down and talk about all of these questions to them. They're capable to nail down the drug interactions. They're capable to talk to you about your laboratories. They're capable to put everything together, because in the whole healthcare system, if anybody, it is a pharmacist who's in that position to sit down and talk to you. The doctors will do diagnosis and treat you, but sometimes maybe not have enough time to look at the comprehensive profile and sit down and talk. So MTM pharmacists are out there. Go seek them, make those calls, ask those questions, and be healthy.
No, I think those are excellent points to cover. Again, to repeat, I think, as I understand, every diabetic is a heart attack equivalent patient. That means every diabetic should be considered as if that person already had a heart attack. That means that person needs to be on a medicine called statin, which is used to lower the cholesterol. So every diabetic should be on statin. Every diabetic should have a blood pressure of 120 over 80, unless they are symptomatic with the lower blood pressure. But the blood pressure numbers are much more stricter when a person has diabetes to prevent many of the complications, particularly kidney complications and strokes. And the thing which I learned from you, which is very, very useful for all our viewers, particularly people who are above 65, is to take advantage of this twice a year, 1 hour, 1 full hour long consultation with a pharmacist, which Medicare covers, to go through all medications, their effects, their mechanism, their interactions, how to take it, how to save money on it. So that's the biggest message. I've heard a lot of diabetic talks, but I've not heard anybody mentioning that program from Medicare until you mentioned it. So big thank you to you, because every Medicare patient should take advantage of it. Ask the pharmacist once or twice a year, sit down and get that consultation. So that brings one more question, which is about what other things every diabetic patient should be aware when they go see the doctor. You cover to take notes, ask questions, but they also should be getting, for example, a foot exam or a eye exam or other things. What other things every diabetic patient should be aware of?
Absolutely. And that was another thing on my mind. I wanted to make sure and cover everything today. So absolutely the foot exam. And as we know, diabetics tend to not heal quickly. And if a foot exam is done timely, we are not going to run into something very extreme like gangrene or cutting the foot off. Those are the extreme ends of out of control blood sugar and all of those. So annual foot exam. The other thing is annual eye exam. And to mention it earlier, I talk about my aunt who's gone completely blind. And sometimes, your vision can tell you that something's wrong, everything else looks good. And the doctor might be pressed to go ahead and make that blood work on you to find out what is just happening. And absolutely keep a tab on your kidney function. So your regular, I would say, 6 months or 12 months, depending on your health condition, make sure that you have those tests in place. And the other big factor I really want to talk about, when I practiced, when I had a diabetic patient, I was very big about looking into the immunizations. Make sure and get your flu shot. That's number one. You are capable of getting both the pneumonia shots, and they are all covered under the insurance. Medicare will pay for it. Medicare Part B will pay for it. You don't have copays to worry about. And the third one, I talk about shingles shot. And these are the things. Shingles has, 2 series. It gives 99% protection from, chances of having shingles. The reason I say that is you're already diabetic. You already have 1 or 2 other health conditions. You don't want to bring pneumonia on, or you don't want to deal with shingles at that point. People could go, there was a lady in my pharmacy whose mom went blind from developing shingles into the eyes. And she would be on top of it, keeping the tab, like, do you have shingles shot? I really want to take it. So diabetes is going to kill your eyes. And if you happen to get shingles, it's just going to make it worse and harder to fight. So those are if you're diabetics, make a point to talk about your immunizations to your doctor. Ask about all those tests that I mentioned, foot exam, eye exam, all of those aspects. So those are the things I would say when you talk to your doctor. And one last thing I wanted to cover was, this is something I follow in my family as well. Discipline starts early on in your life. And so as a parent, I want you to educate your children about food habits, understanding nutrition, understanding disease. Even if it is an 8-year-old, I have an 8-year-old, I literally sit down and talk to her. And if she likes cookies and she wants to have them, she wants to eat 3 of them. But because you have instilled that education in them, or the understanding, or sometimes it could be fear that I don't want to get sick and get a shot or something like that, they will go ahead and stop themselves, because they have an understanding. So early on, you see pediatric obesity is on rise because of the food habits, right? What is out there. So we have to teach them discipline, because if they know to control, and if they know to discipline, or if they have some understanding what the future looks like when you indulge and you don't control, it will make some impact in their life on right time. So I am going to vouch highly for educating your children in terms of nutrition, making right choices, eating healthy vegetables, more plant-based food. Vegan is my aim at some point. I'm a vegetarian, and we get enough protein from our lentils and legumes and all of that. But yes, I think early education in nutrition for children, there's no chapter in schools, right? There's no topic where we cover nutrition for our kids. And I believe at some point it should be introduced. I hear a lot of pharmacists coming out with medical nutrition. There were some articles out there, some companies supporting medical nutrition where they're talking about the doctors having to have those kind of exams, questionnaire. So they're forced to sit and study the medical nutrition aspect of it. And that's, again, taking to prevention is better than cure. So you don't have to use those stretchers to stand up. Using all these medications or insulin is like a support system because now something is damaged inside you, but you can prevent that from happening. So that's my ultimate message to my patients, stay diabetic, free of diabetes.
No, those are excellent points you covered. And I liked about you covering about immunizations because, like you said, diabetes itself is enough of the medical condition. You don't want to add more insults to it. And I think like a flu in diabetic versus flu in a normal person, a lot more complications, a lot more chance of dying. Same with pneumonia, same with shingles. And even when we look at this COVID-19, which is the current pandemic, diabetes is independent risk factor from dying from COVID-19. So definitely a diabetes should be prevented. And if a person is diabetic, controlling the sugar tightly will also lower the chances of COVID-19 complications. So that's one important point. Second thing I loved about the way you covered about starting a healthy habits from the young age, as young as 5-year-old, 7-year-old, I think reaching out for those vegetables and fruits as snacks instead of cookies and other things, including even not having those sugary cereals in the morning. I think if we teach our kids from the early age on by setting our own example, by eating healthy, by not having overweight or obesity, kids will become their own healthy adults. And I think those things are much more easier. Like I like your mantra that prevention is a lot easier and a lot safer and a lot cheaper than a cure. And I think that's where we have to start teaching our kids how to be more preventative instead of wait until age 30 and then start going to see doctor for prevention or treatment of diabetes. So that's a great point you made. I think we covered a lot about diabetes. Diabetes obviously is a 100-hour subject. We cannot cover in 1 hour. There are a lot of questions on Facebook. I think I will save those questions for our next diabetic talk. But I really appreciate you coming, Bhavna. I mean, I sincerely believe that your role as a pharmacist on our page is a unique role, is a very important role. You add so much value. And you already added the points about the single most important point came out tonight was Medicare people having the availability of 2 hours a year consultation. That's the most important thing I learned from you. I did not know even as a physician. So big thanks to you. Have a great evening. We will meet again, hopefully once a month, and we'll cover all different topics, including high blood pressure, including COPD, asthma, all various conditions, because pharmacist obviously is like the expert on all medical conditions, just like doctors are. So we will have a big, wide open field. We will actually ask our audience what topics they want to cover, and we will work with the audience, whatever the needs are. So thank you again, Bhavna. Have a great evening.
Thank you so much for having me. It was a pleasure. And be addiction free, which is be sugar free or be diabetes free again. Thank you so much. Have a great night, everybody. It was a total pleasure brainstorming everything with Dr. Shah. and you are doing an amazing job.
Thank you. Hold on one second.